How do painkillers tell your brain to chill? Have you ever popped a painkiller and suddenly felt relief flood through your body as if a switch was flipped? It's almost like the medicine speaks directly to your brain, telling it to relax and ease the pain. But how does this actually happen? The process is complex, yet fascinating. Painkillers don't just mask the pain, they alter how your brain perceives it, making you feel better, sometimes in a matter of minutes. Understanding how painkillers work in the body can reveal just how powerful and smart these little pills truly are. When you experience pain, your nervous system sends signals to your brain, alerting it to the problem area. These signals are transmitted by chemicals called neurotransmitters, which communicate between the nerves and the brain. Essentially, pain is a message that the body is in distress, and the brain interprets these signals as discomfort. Painkillers, or analgesics, work by interrupting this process. There are two main types of painkillers: nonsteroidal anti-inflammatory drugs, NSAIDs, and opioids, both of which have different mechanisms of action but ultimately lead to the same result: pain relief. NSAIDs, like ibuprofen and aspirin, target the inflammation that often causes pain. They block enzymes in your body that produce prostaglandins, which are chemicals involved in the inflammatory response. By reducing the production of prostaglandins, NSAIDs prevent the activation of pain receptors, effectively lowering the sensation of pain. This also helps reduce swelling, which can contribute to pain. In this way, NSAIDs tell your body to calm down and stop sending out distress signals. On the other hand, opioids, such as morphine and codeine, work by binding to specific receptors in the brain and spinal cord, known as opioid receptors. These receptors are part of the body's natural pain regulation system, responsible for producing feelings of pain, relief, and pleasure. When opioids bind to these receptors, they block the transmission of pain signals to the brain, altering how pain is perceived. This is why opioids are so effective at relieving severe pain, though they come with a higher risk of dependence and other side effects. However, it's not just the drugs that make the pain go away. The brain plays a significant role in how pain is experienced. Research suggests that pain relief is also connected to the brain's ability to release certain feel-good chemicals like endorphins that help dampen pain signals. Many painkillers, especially opioids, can trigger the release of these chemicals, further amplifying the sense of relief. But painkillers don't only target the body, they also affect the brain's emotional response to pain. Chronic pain can lead to emotional distress, anxiety, and depression. Painkillers, especially those that alter brain chemistry, can help ease these psychological effects, providing not just physical relief, but emotional comfort.